Greetings, everyone. Welcome to our 11th prep hour. My name is Steve McPhail, and today we're going to be talking about understanding the updated writing assessment criteria. So first of all, to begin with, a big hello to everyone, wherever you are in the world at this time. Better just turn on my video. Sorry you couldn't see me there. I'll just change this up. One sec, everyone. You can see my green screen background. Let's just get my background working, shall we? Okay. That should be a bit better now. All right, now we're looking good, everyone. Okay. So just getting things set up here in the office, everyone, to make sure it's all working. So what I would like you to do now is just put a big shout out and say where you're located. It's 3 p.m. here on the east coast of Australia in Brisbane, where I'm located. A glorious day here. Can you share your location? I can see lots of people saying hello. Just share your location and time, please, everyone, where you are now. Good morning in Mumbai. I can see we have Farida in Mumbai. Hello, Farida. Hello to Reem. Hello, Ayn in Pakistan. Welcome to Maria in India. Hello to Matt over there in the Philippines. Hello to Madhu and Sharon. Hello to Miriam, a bit south of me there in Melbourne. Hello to Renu in Nepal. John over there in the Philippines. Hi to Nguyen in Canberra, and hi to everyone. So great to see people from all over the world joining in on this session. All right, let's get started, everyone. So you can see my screen here. So as I said before, we're doing understanding the updated writing assessment criteria. And so let's just have a bit of a look at it, everyone. So this is what it looks like. There is a criteria right there in the center, which is purpose. There's our purpose criteria. Then we have a content criteria. We have criteria for clarity and conciseness of writing. We have criteria for organization and layout. We have criteria for genre and style. And we have criteria for language. So these are the criterions that the assessors use to grade your writing. Now we might look at that in a little bit more detail so you can understand how it works. So I'll just bring up a new slide. So this is, I've just turned this into, for yourselves, for the learner, how can you use this criteria to help you write effectively? Well, let's break it down. So purpose, they're giving it a value of 3 marks. So this is updated. The old criteria didn't have purpose. It was embedded in some of the other criteria, but now it has its own standalone criteria. So by writing a letter with good purpose, you will be rewarded if you can do that. So it's a very important thing to be able to do. So what does it all mean? Well, let's have a look. I've got a little self-assessment checklist there, which I believe you can see. I hope that's big enough for you. Might make it a little bit bigger. Does that work for you? Okay, we'll go through this. I might stamp it as we go. So first question you've got to ask yourself, do you have a clear idea why you are writing the letter? So your very first job is to know why. When you look at a set of case notes on exam day, make sure you know why you're writing that letter. Then based on that, you write with that purpose in mind, because then the next question is, does the reader gain a quick and precise sense of what they're being asked to do? If they're taking over the care of a patient, is it very clear, or are they preparing for some sort of procedure? Do they need to do an assessment? What is it they need to do? You need to make that clear. And it should be immediately clear. As soon as they read that opening paragraph, introduction or paragraph, they should know what that patient's condition is, or the context, and what they need to do. The next criteria, content. Does your letter have all the necessary information? And we'll be looking at that in a moment, everyone. We're going to analyze a set of case notes. So does it have the necessary information? Is that information expressed clearly? Does the reader have sufficient information to continue the care? Have you left out something that's important or not? And is the timeline clear from the date you began treating or providing care for the patient up till now? Is that timeline expressed clearly? That's content, everyone. That's worth 7 marks. Then we have another criteria, conciseness and clarity. And this relates to when it comes to conciseness, you don't want to include non-relevant information. If you include non-relevant information, it may distract the reader from the main issue. Perhaps the main issue is buried under too much detail. Or has the information in the case notes been summarized clearly and effectively? You don't want to give too much detail about aspects of the past history that may not be relevant now. You need to think about what's relevant to the person that you're writing to. So that's all about conciseness and clarity, also worth 7 marks. Then we have genre and style. So we're starting to move into the language criteria. Is the letter written in a formal and professional style? A medical referral letter is a formal and professional document. So it needs to be written within the standard conventions of formal medical referral letters. Have you adjusted your language to suit the audience? If you're writing to another, a medical college or another health professional, then you can certainly you can use medical terminology, and certain acronyms may be appropriate. But if you're writing to a member of the public, then or a non-health professional, then you may have to adjust your language to aid in understanding. It's also worth 7 marks. Then we have organization and layout. So that relates to your initial planning before you actually write the letter. And it needs to be in clear, easy to follow. Paragraphs is a very good idea if you organize it into paragraphs. Another question, have you followed the order of the case notes, or did you consider if there was a more effective way to write it? You don't just have to follow the order of the case notes. That may result in a letter lacking a bit of focus. So you've got to plan carefully and select from the case notes and rearrange into your letter. The reader should also be able to quickly and easily retrieve any information from that paragraph that they need. Then we come down to language. Is your intended meaning clear and easy to understand? So that means, did you paraphrase and summarize effectively? Have you expanded on the case notes into full sentences? That's a requirement. Are most of your sentences accurate? Now, It's good if they're all accurate, but that's challenging. But, you know, you need to write with good control and accuracy. Is your vocabulary professional and appropriate? Is your spelling accurate? And have you used capitals correctly? That's all the punctuation elements. So that's language, everyone, also worth 7 marks. So from that, we can see there's a total of 38 marks. That's what the examiners look at. But these are your main criteria that you need to consider when you're writing. Okay, any questions so far? Just let me know. I'll just have a look now. All right, let's leave this slide. So that's the criteria, everyone. Now let's put that into practice, and we're going to look at a set of case notes. Now, the case notes we're looking at, everyone, this is from the OET Centre website, and it's a nurse task, everyone. We're looking at a nurse task today. And if you want to find that task yourself, I can give you the link to look at later. Or perhaps I'll just bring it up on the screen, everyone. That might be easier. Everyone, this is where I am. I'm on the OET Centre website now. This is where the task is coming from. I'm sure you've all visited this website, and I'm in the prepare section, and I've gone to writing sample 2, and you can check this out yourself. You can even get it now if you wish. And I'm doing nurse writing sample test 3, Peter Dunbar. So that's the case I'm looking at. So if you want to print this out after this presentation, you're more than welcome to. That's where it's coming from. Okay, let's go back to my PDF. So this is what we're going to work off, everyone. Now just check if there's any questions coming in. Monica says, isn't the module 42 marks? So that 42 marks is for reading and listening, Monica. But for writing, there's a score out of 38. That's the point system. Anne says, in this criteria, I think it's more difficult to get a B. Oh, I don't really think so, Anne. I think this new criteria is very good, because as long as you write with good focus and purpose, then you're going to be rewarded for that. So it really reflects what health professionals, the way they write in the real world. So this is a very real and valid test, Anne. So I think you'll find it really, really useful. I think it's a very nice improvement, and I think it's going to raise the standard of writing among all candidates for OET, and that will help you in your future work. So I think it's a great thing. Kimberly says, how many points out of 38 do we need? Well, that's not exactly given. We don't really know. You know, you can work out it. You can work it out yourself. You've got A, B, C plus, C, D, E. So you can sort of take a bit of a guess there, but a B is quite a high standard of writing if that's what you need. All right, any other questions I haven't answered? I think we're all good. Okay, let's analyze our case, everyone. Now you should be able to see this. I'll make it a little bit bigger. So on exam day, as you can see here, you get 5 minutes reading time, where you can't use a pen, and then you get 40 minutes to write your letter. So I think it's really important that you use that 5 minutes wisely and study those case notes to get a good understanding of the case. So let's do that now. So good thing, the case notes nowadays are very well organized. We have always at the top, you have a notes section. This is your situation, your context. So always read that carefully. You are a nurse in a community health centre A patient you have been monitoring is moving to another city to live with his daughter. Okay, so a patient that you've been monitoring, so this is in the public, isn't it? It's not in a hospital, it's in a public domain, and they're moving to another city. So this is like the patient's moving, like a transfer to a new region. The patient is transferring. So here's our patient, Mr. Peter Dunbar. He was born on the 18th of March 1932, so he's fairly old, isn't he? I think if we do the math, we can work out he's approximately 86 years old. Okay, he's on medication. He's on metmorphin, he's on ramipril, he's on warfarin, and he's on sotalol, so a few different medications. If he's on metmorphin, I guess we can assume he has type 2 diabetes, and that's mentioned. The ramipril is for hypertension. All right, let's look at his treatment record. So the first date we have here is September 2017. So always pay special attention to your timeline because it needs to be clear when you're summarizing this. So on that date, he was diagnosed, he was diagnosed with type 2 diabetes in August 2016. We've got a fasting glucose sugar levels given here. GP recommended dietary management, low fat, low sugar calorie restriction, and he needed to limit alcohol and do more exercise. Well, let's see if he complied with that. He lives at home with his wife. His wife cooks, and wife managing the dietary requirements. But patient likes 2 to 3 glasses of wine with meals. So he likes a tipple, he likes a drink. So perhaps that's going to be a contrast because the GP said he should limit alcohol. Okay, December 2017, his wife deceased. Oh, things have changed. There's a real change right there, isn't there? Wife deceased. Patient depressed, grieving, referred back to GP for monitoring and medicating. His BSL was still 9. And we've got something non-compliant with diet, excessive fat, sugar, salt, alcohol, wine, beer. So there's an issue right there, isn't there? Unfortunately, his wife has died, and now he's having quite a difficult time in terms of his diet and his alcohol intake. And he's non-compliant. I can imagine that's going to be significant, don't you think? In March, so 3 months later, March 2018, the GP prescribed the metformin. The patient's cooking for self, still non-compliant. So we're getting a bit of a history, still non-compliant with diet, also non-compliant with medication, blames a poor memory. So he's having difficulties, isn't he? He's unmotivated, that's another problem. And he resents taking medication, he doesn't like it. Remember, he's 86 years old, he's probably not happy about this situation. Says he's always been healthy. He only takes a medication intermittently, which means not regularly. But he is encouraged to take it regularly. He was educated regarding the needs of the regular medication and potential adverse effects of intermittent dosing. So education was given, and even some memory aids, perhaps a Webster pack, something like that was discussed. Another 3 months later in June, he was hospitalized, and he had a myocardial infarction after having retrosternal pain. And he had nausea, vomiting, dizziness, and sweating. And that MI was confirmed by ECG. Treatment was given, and he was also diagnosed with atrial fibrillation post-MI and started on sotalol and warfarin therapy. Okay, so he's having a hard time, this poor chap. He kept attending twice weekly. So remember, this is your clinic in the community. So you've been keeping an eye on him over the following months. By the time you saw him in October, he was walking with a stick and he developed signs of diabetic neuropathy. and he has poor exercise tolerance. So it's now, not only does he not like exercise, but it's difficult for him to do it because he has restricted mobility. Still, he has issues with his diet. He's still making it for himself, but maybe not very healthy food for his condition. Other ideas were discussed: a community-based delivery service of meals, such as Meals on Wheels. Perhaps moving in with his adult children, and they mentioned the son and the daughter, or even the retirement village. He had a respiratory infection around October, where he was prescribed amoxicillin, but he discontinued his other medication. So we have that medication compliance issue all the way through the letter. So that's going to be very important to mention. And education was given for that as well. Then this is today's date, everyone, the last date here, 22nd of January, 2019. He attended with his daughter. And look, he's going to move to Centreville. So that kind of relates to a previous discussion. You must have realized it's time, Peter. It's time. You know, it's difficult for you to manage. You need to live with somebody or a retirement village. He chose his daughter, so he's going to live there and he's going to move there. The daughter will cook, but she requires education. The daughter advises that patient is resistant to dietary alterations. So he's an elderly chap and he doesn't want to change, but he needs to. He's still having trouble with his medication, missing or double doses. He's refusing to reduce salt, sugar, alcohol, fatty food intake. And he does need monitoring and encouragement. And then down the bottom it says, letter to transfer the patient to the care of the community health nurse. So that's our task, everyone. We're writing a letter summarizing that situation and transferring the care to the community health nurse in Centreville, where the patient's going to live. And that's what the writing task tells us to do. Write a letter to the community health nurse outlining the history and requesting ongoing monitoring. Okay, so that's the case, everyone. I hope that's clear in your mind. So now let's think about what we would include. So you imagine on exam day, you'd spent 5 minutes reading those case notes. And it tells us in the task, expand the relevant case notes into complete sentences. So always do that. Do not use note form. So you can't just use short form or omit subjects or verbs or prepositions or articles. It's in English. It's English written in complete sentences. Use letter format, and we have a word limit there, 180 to 200 words for the body. Okay, that's our task, everyone. What do you think? You're all health professionals. Can you help this person? Can we provide a comfortable life to Peter Dunbar? Are you ready to refer him on to someone else? What do you think, everyone? I'll bring up my new share now, and we'll look at what a letter should look like, everyone. Any questions, feel free to type them in, but I hope those case notes are clear. All right, now let's have a look, planning. So I've done a bit of a plan ahead. When on exam day, you can make notes. There's even a draft page on your writing task sheet, you know, where you write your answer. So not a bad idea to make a few notes and consider what you're going to include and perhaps what you're going to summarize and perhaps what you're going to omit. So for the purpose of this, okay, what are we going to include? And feel free to add anything you like here from memory. Anything you think we should include, you just write it in. But obviously he has diabetes and that's progressed because he's now got diabetic neuropathy. So we're going to talk about the diabetes and very much so the progression, right? Because his condition is getting worse, isn't it? We're going to talk about medication, especially due to that non-adherence. We know this is a real problem for Peter, so we need to make that clear. We're going to talk about his social circumstances. He's an elderly gentleman and he's living alone and his wife's died. So all of that contextual information is relevant, and also the fact that he's going to live with his daughter. So we need to include that. Yep, thank you, Monica. That non-compliance to medication, that's a big point, isn't it? We might mention that he's got a poor memory because that's his reason. So maybe he has a memory issue. Maybe that's a red flag. So we might mention that. We're going to talk about his medical history. Obviously, he was hospitalized with the MI and the atrial fibrillation, so that will be relevant. Alice says transferring to another community. Absolutely. That's got to be included. And that relates to his discharge needs. So we have to talk about his current state. What's happening now with relation to, as you said, Alice, transferring to another community, going to live with his daughter, issues with his diet, and so forth, alcohol consumption. And also we're going to need to include that education for the daughter, because the daughter requested it. She's worried. She doesn't know how to look after her father because of his condition. So she'll need support, and then monitoring for the patient. So that sort of summarizes the case of what we need to include, I think. Carl's mentions diet issues. Yes, Carl. So summarize. Well, we're going to summarize his alcohol history. There's a lot of information there, but I think we'll find we can summarize that fairly concisely. And then obviously his dietary history is very significant in this letter. So we'll be doing that. What information do you think we're going to omit, everyone? Does anyone have anything that you think we should omit? Anything that you think's not relevant? Ali says, is this for nurse? We're using nurse case notes, Ali, to demonstrate how the updated criteria works. But it's a patient history, patients at a case note, so beneficial for all professions. So, well, we've got here his medication non-compliance as well. We're going to mention that. But what are we going to omit? Well, we're going to omit the past history of his wife cooking for him. There's a lot of information about that in the beginning, but that's not really relevant now, is it? We'll mention that his wife has passed on, but we're not really interested in that his wife used to cook for him because it has no relevance on the current situation. He had a respiratory infection back in October, but it was treated with amoxicillin. It's not the main issue. It's more a distractor. We don't need to mention that because it's already been treated. So, and there were a lot of details about the hospital admission, but apart from the medication and the medical history, we probably don't need a lot of details there because that also occurred quite a while ago, 6 months ago. So not a lot of detail there needed. So that's our planning, everyone. So you can always, good idea to make some notes of what you're going to include, what you're going to summarize, and what you're going to omit. And there are details of the medication dosages, so we may not need to put all that information in full. Okay, planning the letter, everyone. I've made a little plan. So in our introduction, we're going to put the contextual information, his age, marital status, chief complaint, and daughter, involvement of daughter. You'll see that in a moment. Body paragraph 1, I thought it might be a good idea to start with the medical history, his non-adherence to medication, the progression, and his current health. So all about just in one paragraph, everyone. I don't have to follow the order necessarily of the case notes. I'm going to select the information a little bit more topic-based. So I'll talk about his medical history first and that non-adherence. Body paragraph 2, we can talk about his current needs, the continuity of care needs, education for daughter, monitoring for patient. I mean, in a sense, it's chronological, but it's also topic-based, which will make it hopefully easier to access information. And then a nice short and sweet conclusion that you will see. Okay. Alice says, no need to mention past meds unless need to be continued by the new carer. Yeah, I think that makes sense, Alice. Zohar says, how would we know that which information should be omitted? Well, that's where you use you think about who you're writing to, Zohar. You think about who you're writing to and what do they need to know to do their job. They've got to continue the care. So you have to use your judgment there and think about what's most important in this patient's history. That's your understanding and comprehension. And which aspects of that history do you need to convey? And let me show you how it works. Okay, so here's our letter. So we've got the date, 22nd of January 2019, community health nurse, Eastern Community Health Centre. So we've got the address there. Dear nurse, re Peter Dunbar, date of birth is written there. Okay, then we start. This is the introduction, everyone. I'm writing to request ongoing care for this patient, an elderly widower with diabetes who will be moving to Centreville to live with his daughter. Mr. Dunbar's wife died in December 2017, and he has been under our care for the past 18 months. So that's our introduction, everyone. So how does that relate to the updated criteria? Well, let's have a look. We have a criteria called purpose. So what is the purpose of this letter? Well, it's a request for ongoing care. And we can see in this example that we have requested ongoing care. So that's good. The reader knows that they have to provide ongoing care. We've mentioned his age and marital status. I mean, we didn't say his exact age, simply he's elderly, which is a nice touch. And he's a widower, which means that his wife has died. So that's relevant. We've got the chief complaint, which is his diabetic condition. That's the main issue there. And very importantly, the context is immediately clear. He's moving to Centreville to live with his daughter. We've mentioned his wife died in December 2017, and he's been under our care for 18 months. So everyone, it's really useful to do that, to really put the context of the situation clearly. So it's very important for you all to do that. When you look at the case notes, think about the context and situation and think about how you can express that. It's not a short introduction, it's a couple of sentences long, but it paints a picture, everyone. It gives us the background. All right? That's what Miles says, long introduction. There's no limit to how long your introduction should be. I think when you're writing a letter with good purpose, giving that contextual information in the introduction is a good thing, especially with our updated criteria. It's a nice way to write. It's not the only way to write, and other letters may have a shorter introduction, but in this case, we've painted his situation really early on. So the reader, the person you're writing to, that next community nurse, they know the situation now. They understand this patient's circumstance. All right. Alice says, according to Rebecca, we shouldn't write the word patient. Well, when we say, that's a good question, but here, when we've said this patient is referring back to Peter Dunbar. So it's not just the patient. This is a particular patient. Which patient? The patient you mentioned in your subject line. Okay, let's continue. Then let's look at our body paragraphs, everyone. I'll read it out. He was diagnosed with type 2 diabetes in 2016, for which he's been prescribed metformin. He has a history of non-adherence to his medication regime, stating poor memory as the reason. He has also been resistant to any dietary changes or alcohol reduction. His condition has steadily deteriorated, and since October 2018, he has displayed signs of diabetic neuropathy. His mobility is impaired and he walks with a stick. He was hospitalized following a myocardial infarction in June 2018, which led to a diagnosis of atrial fibrillation. He was commenced on ramipril, warfarin, and sotalol at that time. Okay, so that's a paragraph on his medical history and progression, everyone. Next paragraph, he presented to our clinic today, accompanied by his daughter, who will cook his meals. It would be appreciated if you could support her with education regarding how to care for a diabetic patient. Please note, Mr. Dunbar's non-compliance to medication, diet, and alcohol intake has remained an issue. So careful monitoring and encouragement is required. Okay, let's look at our criteria. How does that play on the criteria? Well, I showed you before about how important content was. So how have we gone with content? Well, we've got the relevant medical history, which is this diabetes progressing to diabetic neuropathy, his myocardial infarction and atrial fibrillation has all been mentioned. We've also mentioned, very importantly, about the non-adherence to medication, as well as his resistance to dietary changes and alcohol reduction. So it's very clear. We know what's happening. We know the challenges that he's facing. We've also importantly identified a deterioration in his condition with that clear timeline written. So in terms of content, all that necessary information is there. There's another criteria called conciseness and clarity. So you can see there's a lot of summarizing here, everyone. You can see a lot of summary sentences where we've just said, we didn't mention his diet, we didn't talk about what he eats. Pardon me. On the case notes, we know he has excessive fat, sugar, salt. We know for alcohol, he likes wine and beer. That wasn't mentioned. We just said he's resistant to dietary changes. So we didn't put the detail there. We didn't talk about what he drinks, his preferred alcohol, but we simply said he didn't want to reduce it. So that's saving us words and helping us write with good focus. In the criteria conciseness and clarity, we have given a summary of the case notes, and we've omitted non-relevant details in the history, such as, if you remember, his wife used to cook for him, and there was things that the GP advised way back in the day, but it's no longer really relevant because we're writing from today's perspective. Also, we're not repeating information unnecessarily. So that's, so we've looked at 3 criteria so far, everyone. We've looked at purpose, we've looked at the content, and we've now looked at conciseness and clarity. Let's continue. I'll just go back one page. There's a question or two coming in. Patient says, can we write patient name at the beginning of a sentence? Yes, I think that's a really good idea. I think you can. We could have changed this. I've used he, but I could have said Mr. Dunbar. That would be nice. That would be nice. We could add that. I've used his name down the end, but I think that's a good rule to follow. Tayeba says accompanied by can be replaced by escorted. Not really in this case. Escort's more you escort somebody, take someone somewhere. But when he presented, accompanied is a bit more natural there. All right, let's continue. So this is the whole letter, so you get the whole picture, everyone. There it is, all nicely laid out for us. We've got our conclusion. Should you require further information, do not hesitate to contact me. Yours faithfully. So let's have a look overall. We've got another criteria, everyone. Organization and layout. Information, it's organization and layout, how the information is grouped. So in this case, we've got quite a reasonable size introduction, but still just 2 sentences long. That's our introduction, and that gives us the context, everyone. Very important to give that context, I think, and a clear purpose. Paragraph 1 provides that medical history with clear time references throughout. And paragraph 2 talks about the ongoing care needs. So quite nicely written with 2 distinct paragraphs, each paragraph having a different topic. Okay, Alice says yours faithfully. Shouldn't it be yours faithfully? Yes, maybe I put maybe that's a typo. Yes, I think lowercase would be better there. Marwan says this letter exceeds 200 words. I don't think so. I think this letter's about 200 words, Marwan. 200 words for the body of the letter. Now, let's look at the criteria, genre and style. So firstly, for genre and style, this is about language, everyone. We've used professional vocabulary appropriate to the task. So we've got things like under our care. That's nice language, right? That's medical language. He's been under our care. We've got the word non-adherence. He has a history of non-adherence to his medication regime. So that's appropriate language. Stating poor memory. So again, that's formal style. The patient stated poor memory. We've summarized it with expressions such as dietary changes and alcohol reduction. It's very formal. We've mentioned that his condition has steadily deteriorated over time, so good language. His mobility is impaired. So again, precise vocabulary, everyone. And then later on, we've mentioned about his non-compliance as well. So nice vocabulary in this one. Debas says, please discuss a referral for medicine letter. Yes, we will be doing that in a couple of weeks. Rest assured, Debashi. Farida says, when can we put sincerely or faithfully? I think the basic rule is for sincerely. If you know the person who you're writing to, you can use sincerely, yours sincerely. If you don't know their name, if no name is given and you only know their title, then it's appropriate to use yours faithfully. And Anne asked that as well. Well done, Anne. Anne was all over that. Good job, Anne. Now, it's clinical and factual. So there's not a lot of, notice there's not a lot of signal words. There's no in addition, moreover, therefore, furthermore, as a result. You know, we don't really need to use that. The best signal words you can use are actually time references, everyone. So look at the time. The timeline's really clear here. In December 2017, he has been under our care for the past 18 months. So that's our present perfect for a duration, a period of time. We've got past tense. He was diagnosed with type 2 diabetes in 2016. That's very clear. We've said his condition has steadily deteriorated since October 2018. So again, we've used present perfect with since. So this has happened over a period of time. We've got past tense. He was hospitalized in June 2018. And then we've got he was commenced on ramipril, warfarin, soldil at that time. That refers back to June 2018. So very clear timeline, everyone. And then we've got today. He presented to our clinic today, accompanied by his daughter. So all of these things help the reader understand exactly what happened and when, and how that patient's condition deteriorated and what health event occurred. So always pay special attention to the timeline, because that helps convey a clear summary of what occurred. Okay, let's continue. And then lastly, under genre and style, we've got appropriate level of politeness for requests made, especially in the introduction and concluding paragraph. So it's polite style. We've said he's an elderly widow. That's polite. We didn't say he was an old man. So that's the right terminology. In our request, we said it would be appreciated if you could. That's polite request. And should you require further information, that should, a little bit more polite than if. So yes, it's an appropriate level of preciseness. So this letter would get good marks under the criteria genre and style. Farida says, instead of using he, can we put client's last name? Yes, we've got it in the beginning about Mr. Dunbar's wife. We've got it down the end. And definitely we could have put it here. Instead of he, we could have said Mr. Dunbar. But it's so closely linked to the introduction, it did flow quite naturally without it. So remember, everyone, it's language. So there are lots of variations. I'm sure if you look out on the internet and in many sources, you'll see many variations of writing. So it's about looking at all the different styles, not being too caught up in each individual rule, but just getting a general sense of what is the preferred style. And the more you read, the greater you will understand. Okay, let's continue. And then we've got another criteria, everyone, which is called language, right? You're doing an English language test. So language is an important criteria. So sentence structure. You know, you can expect in natural English, if you're summarizing a history, that you will use some simple sentences, some compound sentences, and as well as a few complex sentences. So we can see the first sentence in the beginning with the relative pronoun who. There's an example of a complex sentence. We've got another one here. He was diagnosed with type 2 diabetes, for which he has been taking for the diabetes. Another complex sentence. So we've got a few complex sentences with relative clauses. And then we've got other sentences which are compound sentences. And this last one, please note Mr. Dunbar's non-compliance to medication, diet and alcohol has remained an issue. So careful monitoring. There's our compound sentence with so as our coordinating conjunction. So that's a good example of a nice variety of sentences. Verb use. Verb use here is very good, and the verbs and the time references are aligned. So a range of verb tenses, simple past, present perfect, present tense. We've even got future. His daughter will cook for him. And we've also got passive voice. He was commenced on ramipril. He was diagnosed with type 2 diabetes. So a range of different verb forms. It has expanded on the case notes with correct use of prepositions and articles. The case notes omit prepositions and articles quite often, but we've put them in the appropriate places, and the punctuation and spelling is accurate. So in terms of language criteria, it matches. All right, Anne says, is this for the new criteria for writing? 100%, Anne, that's what it is. This is the new criteria I'm showing you. All right, starting from the exam on August 31, everyone. From August 31. So there it is again. Purpose. We spoke about purpose, everyone. This letter had a good purpose. Content, the information. We carefully planned the letter. We thought about what information to include, what information to summarize, and what information to omit, which relates to clarity and conciseness. We got our organization and layout, so it had all that information with our introduction and body paragraphs clearly given. Genre and style, it was professional in style, used good range of vocabulary, correct politeness. And then finally, language. The language was appropriate and accurate. So this is what you need to think about when you write to the new criteria, everyone. And if I was going to give you a piece of advice, I would say to you, plan your letter carefully before you write, because that's going to help you a lot with purpose. Make sure you know why you're writing that letter, and think about who you're writing to and how they can continue the care. Think about what their profession is. Maybe they're a specialist. So you're going to you're going to include information relevant to their professional area. So you need to think about all these things as health professionals. All right, now we can do some questions. Marwa says, Steve, using so is informal. You know, I would agree with you generally, Marwa. So can be quite informal. It's true, but not always. It's English. There's always situations where where it can work. And in this case, it's saying for that reason, so careful monitoring is compliant, because this alcohol intake has remained an issue. So careful monitoring is required. In this sense, it's quite formal. So a lot of things about language, it depends how you use it. So there is flexibility in these rules. It's not right, wrong necessarily. There's degrees, and it just depends how you present that information. Hamza says, can you upload the video? Yes, this video will be available for viewing on Facebook. Marwin says, in the exam, are they really follow the criteria that you've been mentioned? Yes, that's the new criteria. Here it is. And your assessors will be using that criteria to grade you 100%. So very important. Yannick says, for an emergency referral letter, could I write it from the first visit? Possible, but perhaps for an emergency, it depends on the case, Yannick, but I would say for referral letter, perhaps it's better to put the most recent information first. But it's case by case, honestly. What I would say for an emergency letter is you don't necessarily need to include, maybe there were earlier visits that were for different issues, in which case you would omit those early visits and focus on the visit related to the main problem. And sometimes for emergency letters, that main issue could be stated in the second visit, not the last visit. So really, to answer that question, you need to know where the important information is in the letter. And you won't know that until you read it. Think about patient history. Every patient's history is different, and you need to react to what you're given on exam day. So practice build your confidence, do your best to understand the case. That's what you need to be able to do, because every case is different. Farida says some last minute tips for reading. I think you'll find, if you look on our Facebook page, the OET Online Facebook page, you'll find a nice little video there for that, Farid. So have a look at that. Leji says, can we use consequently, therefore, hence, so, and but? Yes, yes, all those words in the right place. I wouldn't overuse consequently or therefore. I wouldn't overuse them, but if it's the right place, yes, it's possible. Definitely but, because but's a conjunction. Don't use but to start a sentence. So use but to join two clauses. Thanks, John. John counted the words for us. 192 words. Good job, John. Phew, we're in the word limit. So there you go. Exactly what you want. All right. Any other questions from the audience? I hope I haven't missed your questions. If you do, type them in now. And about, look, if you're having, if you need some help with writing, everyone, come to OET Online. We've got a great range of writing courses available to help you. And all our courses have been updated to include the new towards the new writing criteria. So lots of up-to-date information there. Doesn't matter what your profession is, whether you're a nurse, doctor, dentist, pharmacist, physio, and so on. We've got courses for all professions. Yes, so that's our, and we do, of course, it's not just writing. Today we spoke about writing, but we can help you in whatever your needs are. Writing, reading, speaking, or listening. And also wherever you're located, we run virtual classes online. You'll see me teaching in those classes along with our team of OET teachers. So wherever you're located, you will be able to find classes at a suitable time zone. And yeah, just come along to our website, everyone. If you're interested in studying any of our courses, I'll just put the link there for you. You can check it out there. Okay, Kimberly says, do we have to write generic drug names in lower caps? Yes. Generally speaking, Kimberly, generic medication is in lowercase and brand names is in uppercase. All right, I think I've tips for improving and adjusting grammar. Well, yeah, I mean, in our courses, we run specific grammar classes every Monday. So I would encourage you to consider enrolling in one of our courses. We've got a grammar and vocabulary clinic as well. So there's a wealth of information just for health professionals. I think language use is very important. So definitely study it in whichever way is suitable to your situation. Sylvia says, can we exceed the word limit? Yeah, it says the task question says approximately 180 to 280 words to 200 words. So sure, you can go a little bit over, but do practice to be concise. But I would say the 10% rule, approximately, you could be 10% over. I'm a little bit cautious of being under because perhaps you'll miss some aspect of content that's important. Yeah, but practice to write within those limits. And if you're a sentence or two over or under, if you've written well, you'll still be, you know, the assessors will grade you accordingly. No need to leave a line between the salutation and the re. It's possible, Tintu, you can. I would just lay it out in an organized manner so it's easy to follow. Butchik says, is the word limit only in body paragraph applicable? Well, I think in the example we saw today, I think the introduction definitely part of the body, but perhaps we don't have to count the conclusion because it was short and sweet. Paf says, can you tell me how to expand the purpose of the letter? I think I explained that in the beginning, Paf. You saw that example of a letter with a good purpose there. And that's one example, everyone. You could write a shorter introduction and elaborate further in the next paragraph and still have a clear purpose. So you don't have, the purpose doesn't, in the introduction doesn't have to be overly, oh, the whole purpose is in the introduction. It's not like that. You might just put the main idea, general idea in the introduction, and then you continue to develop that purpose through your letter. So purpose does not mean introduction only. But after reading the introduction and a couple of sentences, the reader should definitely have a clear idea of this patient situation, and they should be gaining a sense of what they need to do or what that patient's needs are. It shouldn't be buried or hidden or right at the bottom of the letter. Mao says, when we have a long list of medications, how can we write it in a good way? Is there any trick? Well, you've got to decide how much you want to include, but perhaps you don't need to state, for example, you can, here's something you can do, Moa, rather than saying if the patient's on antibiotics, antihistamines, analgesics, prophylaxis, or whatever, then you don't need to say each medication, generic or brand name. You can classify it within the class of medication. So that's a useful tip. Right, Manik says, what's been changed for the writing exam? Well, the task hasn't been changed. The task is exactly the same, Manik. I think I recognize you there from previous studies. The task hasn't been changed at all, just the assessment criteria like we've discussed today. Yannick says, can we separate one line between paragraphs? That's a good idea. All right, I think I've covered all the information. Monica says, thank you. Can you please upload more recent writing tasks? Well, we've just done one. Otherwise, come and study with us, Monica. You'll find it all there. Okay, and the last question I'm going to answer, Mohammed says, purpose, can you explain the difference between the new criteria and the old criteria? Purpose was always assessed. Always, you know, writing with a good purpose, you were rewarded for that under the old criteria, and it fell under different, the criteria just was framed differently. But what they did now in the new one, they've given purpose its own special little criteria. So its own little box, its own little segment. So that's the difference. It was always assessed. It's just assessed a little, there's a little bit more emphasis on it now, because I think everyone realizes that writing with good purpose is very important. It's highly valued among health professionals. I mean, you think about it yourself. If a patient is being referred to you, do you want to know why you're going to take over the care? Do you want that information to be clear? I'm sure you would say yes, everyone. I'm sure you would say yes. Okay, and all right, so thanks everyone. That was Prep Hour 11. People are asking about when are we going to do a doctor's one? Very soon. Keep your eye out on the Facebook page. Once we've worked out a date, we'll definitely do another one. All right, thanks very much for coming. Wishing you good progress in the exam, and we'll see you online. Goodbye.